organized Associated Medical Services in 1937 and was repeatedly assured that it could not succeed. Such plan had never been operated before, and there were many people who said it can't be done, particularly the insurance industry.
In 1939, when Associated Medical Services opened its doors, it had one subscriber, Jason Hanna. In 1970, when the government control of health insurance was instigated, AMS had a membership of nearly 300,000. It had reserves sufficient to organize and support the Institute for the History of Medical and Related Sciences. It also established a chair in the history of medicine in each of the 5 medical schools in Ontario.
My name is Paul Potter, and I was the first Hanna Chair here at Western. I began in the fall of 1974 and carried on until 2012, when Shelley became the second Hanna Professor.
My name is Shelley McKellar, and I became the Hanna Chair in 2012, and I am pleased to be affiliated with both the Schulich School of Medicine and Dentistry as well as the Department of History at Western University.
I think what we can say is over the years, the Hanna Institute, or the AMS, has always supported us. It supported us right at the beginning, fundamentally, paying for the support of the professor, but also to build up the library and so on. And then over the years, we had postdocs, we had visiting professors, we had an adjunct Hanna professor for a while. That was Professor Jim Connor. So I'd be curious to know, how did you ever hear about the Hanna Chair?
I was first exposed to the Hanna Chair at McMaster University. So I was turned on to the history of medicine by a lecture by Dr. Charles Rowland, who was the Hanna Chair there in the 1990s. And he actually was able to speak to both medical students and history students. I was a history student at the time, to actually get them interested and engaged and excited about history of medicine in their particular career path. We've never had a problem with gaining the interest of medical students, whether it be through the Oster Society, which Professor Potter has cultivated from its earlier roots as a faculty society, to a medical student history of medicine club, which they have really embraced and developed.
That's one thing that we've been very fortunate, and I think AMS has supported that well. That it's not a matter of, we've established 5 chairs, you either make it one of those 5 chairs or you're nothing. That's not the way it works.
No.
It works that residents, doctors, practitioners, it's all somehow relates to each other. I mean, the different parts. And I think that's been very productive. And I think that's the only thing that will work in a country like Canada.
And I think that's AMS's ticket to being successful, is this ability to change and to respond to what they think the needs are, whether it be the newly established Hanna Chair up at the Northern Ontario School of Medicine that's looking at Aboriginal health, whether it's supporting programs at McGill or at Calgary through established history of medicine programs there, and responding to what the new research and lines of inquiry are. Traditionally, the base that supports history of medicine is still there, but I think they're encouraging and strengthening the community in new and different ways that I think can only work to our advantage.
It's great to see you all here. This Osler meeting also serves as a practice session for those of you that will be presenting at the upcoming History of Medicine Days in Calgary.
My name is Philip Oldfield, and I started here in the Thomas Fisher Book Library at the University of Toronto in 1981. When it opened in '72, there were about 300,000 books. Now, today, there's about 800,000. And this is where all the great books are, in this library. So right now, we have about 15,000 books on the history of medicine. I think with the original collection was about 8,000. So we've really grown. And of course, Associated Medical Services has been responsible for us acquiring a lot of this material. It's enabled us to continue building the collection.
I'm Brian Hodges. I'm Executive Vice President of the University Health Network now, a physician and psychiatrist and a professor of medicine at University of Toronto. But once upon a time, I was an FPO fellow when I was a medical student. Starting in '87, '88, meetings were held that brought people together to think about medicine and its social responsibility. It would go on to be called Educating Future Physicians for Ontario and would be a 5-year initiative in first phase and then 3 or 4 more years in a second phase. It became a major province-wide transformation of medical education. Following about 8 years of FPO work, a framework was released of physician roles, 8 roles of physicians, and this was revolutionary. Fortunately, the Royal College of Physicians and Surgeons of Canada was also thinking about reforming the framework for the training of physicians nationally. So they picked up the FPO framework, and today, almost all of that work lives on in something called the CanMeds framework, which has now been adopted by something like 28 countries internationally. 25 years later, FPO has made a huge difference, but AMS detected that in the area of caring and compassion, some of the advances in technology, the changes in the system, the rise in burnout meant it was time to look again. So when AMS launched the Phoenix Project and I became involved with that, the first thing I wanted us to work on was a fellowship program.
So we're doing our very best to try to bring to our medical students these important ideas that will allow them to be compassionate, equitable healthcare providers of the future.
The AMS Fellowship has really helped me to develop a clear plan for dissemination of the patient storytelling curriculum. I've also been really connected to like-minded people, and I've gained a lot of support through the connections that I've made with the AMS family. Thank you.
My name is Seema Marwaha. I'm an internal medicine doctor. I work here at Trillium Health Partners, and I spend part of my time doing research and part of my time doing clinical medicine on the wards, and I'm a 2016 AMS Fellow. So one of the projects that we're doing with the fellowship is through VR, where we're using VR perspective filmmaking to see what a healthcare experience would be like from a patient's perspective. One of the first videos we did was with SimMan over here, where we took a code blue scenario and put the camera right in his mouth so you could see what it was like to get chest compressions, what it was like to have people injecting drugs, and what it was like to have people talk about you when you're critically ill and have you not be involved in the conversation. We think it's filming techniques like this that can help people understand compassionate care and what it's like to be a patient.
One of the pieces that AMS is very interested in is doing a series of initiatives with emerging leaders. And this group is very critical in terms of really reflecting who are those emerging leaders in healthcare and how can we support those individuals as they move forward. It's our 80th anniversary. And we are doing a series of initiatives, activities. AMS has its roots in history and looking at the history of medicine, which now is broadened out to the history of healthcare. And one of the important components of the symposium is understanding what has historically happened in Canada. How did Medicare come about? How has it moved and advanced? What have been the barriers? And if we understand that, can that help us to move into the future? Because we recognize that for many, many years, there have been a number of panels, commissions, you name it. A lot of us have been around for a lot of them. And we certainly have moved, but we now know that we also need to continue to look at Medicare and what are the changes that are required, but more importantly, how are those changes going to come about?
So I am absolutely delighted to be able to talk to you about AMS Healthcare. You know, it's interesting because AMS Healthcare started off with the start of publicly funded Canadian healthcare, right? It was one of those early insurance schemes that allowed people to achieve healthcare back in the old days before Medicare began. And what it's done is to continue that tradition of a humanistic approach to the delivery of healthcare. I'm very impressed by the work that AMS Healthcare has done in both training and supporting research and development of the compassionate aspect of healthcare, focused on patients, focused on providers, the contribution, a very proud history, a very strong performance today, and a very exciting future. And delighted to be able to say happy birthday, AMS Healthcare, and of course to say congratulations, best wishes, and keep the great performance going.